joining us for another episode of the Wellness Doctor Network. I'm Dr. Holland Meyer, along with my guest, Dr. Matt Thomas. Thanks for joining us.
Thanks for having me, Holland. I appreciate it.
Absolutely. So you're a chiropractor. Why don't you tell our audience what chiropractic is to you and what your approach is to healthcare?
Well, chiropractic care is a part of healthcare, and as a chiropractor, we keep the structure that protects the nervous system healthy. You know, the brain and spinal cord control everything, and if the joints that protect it are not healthy and are not moving properly, then you're going to have issues. If there's any nerve interference there that affect these various muscles, tissues, and organs of the body, you're going to have problems. So as a chiropractor, we like to make sure we keep things healthy and keep things moving properly.
Awesome. And as chiropractors, we remove that interference.
Absolutely.
Perfect. And what's your approach to healthcare, just in general?
In general, you know, I think healthcare is mind, body, and spirit. I think you have to take care of all three. You know, exercise is paramount. You know, what you feed your mind. If you don't, you know, read and nourish your mind, I think you can become very unhealthy there. So knowledge is key. And then having a healthy spirit and prayer, meditation. I think all of these things matter in keeping the body healthy. If you neglect any of them, you're going to have problems, you know, but if you focus and you have, you know, all three working for you, a healthier marriage, healthier kids, you know, healthier life, happiness, joy, I think it's all encompassing. You have to have all of it.
Absolutely. And you're speaking right up my alley with the mind, body, and the spirit on all that. So perfect. And tell us about your office. What kind of services do y'all offer here at your chiropractic office at 360 Wellness? Okay.
Well, you know, we are a chiropractic office, so first and foremost, you know, a staple of our office is chiropractic care, decompression, massage, and rehab. So we've been doing that for years and have been very successful with our patients in doing so. But recently, in the past few years, we've expanded into more of a wellness practice to where now we offer metabolic programs, weight loss, red light therapy. We treat we treat the symptoms of neuropathy. So, you know, we have patients that come in, you know, now for more of a total wellness.
I love that whole concept, and it allows you to help people in all those areas and just a more well-rounded approach too.
Absolutely,
yeah,
absolutely.
One thing I want to know more about is this weight loss therapy. So tell us what that involves and what makes your program unique.
Well, our weight loss programs are all customized, so it depends on the person. You know, one size does not fit all. I know a lot of people are looking toward the counting calories model. You know, they're going for prepackaged foods. Some of these things that are, you know, very popular nowadays, but I don't think they're the healthiest. You know, with what we do, we use metabolic programs along with our red light therapy, and I think those work really well. Now,
so your metabolic program, you're customizing it. Tell me a little bit about what that means to you.
Absolutely. Now, the metabolic program itself, you know, is dependent on each individual. So we use a multi-prong approach to weight loss, to where we target specific areas where people might be causing them to store fat. So the alkalinity of the body is key. If your body's acidic, you know, obviously, you know, it feeds cancer cells, and you know, you're going to store fat if your body is acidic. We look at the intestines. You know, obviously, if you've got candida built up, you're feeding it with sugar. You know, you've got to get rid of that, or your body is absolutely going to store fat. The hormones, that's another area. You know, if we don't address that, your body's going to store fat. There are so many things that go into why a person is storing fat, and we need to figure out exactly what that is so that we can help them.
Absolutely. You're speaking my language of what I've been speaking for the last decade as well. So I love that your weight loss program, you're identifying the root cause of why they're keeping the fat on or can't lose the weight. And then let's go to more of the superficial type of things as well, the red light therapy, so that we can target those areas. Tell me more about that.
All right, the red light therapy is very exciting. The technology's been used in burn units for the past 40 years. It's completely safe. But in recent years, the technology of red light therapy has expanded to where now it's used specifically for fat reduction. Awesome. So the people that come in typically will see between 2 and 5 inches lost in a single 32-minute session. So
That's incredible. I don't want you to go over that point too fast.
That's good.
But
It's
that is
huge.
incredible. So it's immediate results.
Immediate. You know, we measure before and we measure after,
Yes.
and on average, it's between 2 and 5 inches in a single session. And the device that we have was the first one to receive its FDA clearance. And during the FDA's clinical trials, they found that the average person lost 3.5 inches in a single session. So
that's incredible.
yeah, our findings have been right along with that. Many times we have people lose more. It's fantastic.
That's awesome. And it doesn't surprise me that you have the state-of-the-art equipment either.
Oh yeah, we were the first one in town, you know, and
Yeah.
you know, in the area, as a matter of fact, and yeah, it's fantastic.
That's awesome. So so with the weight loss, before we get off that, you can target certain areas.
Absolutely.
Okay.
Absolutely.
So you can target certain areas, and then also, what if someone comes in and they don't have a specific area of fat? Who else can use this?
Well, we have a lot of people who come in that you would look at them and you wouldn't think that they would need to lose much. But some people come in just to target areas to where they have a little bit of cellulite, you know, that they want to tighten up. You know, we have mothers who have had multiple babies who just maybe just have a little bit of loose skin, and we can help tighten that up with the red light as well. Some people, you know, they focus on their face. People who have wrinkles around their eyes, maybe getting older, you know, they want to tighten things up there. The red light works really well for that as well.
I think I'm going to stick my whole entire body into this.
That's
It's kind of like
fantastic.
a facelift a little bit.
Absolutely. It's just
That
like
is
that.
awesome. That's awesome. You've told us a couple of success stories. Which one stands out the most to you?
On the red light?
Yeah.
Okay. On the red light, we had a woman come in and lose 9 3/4 inches in a single session, which was remarkable. I mean, that was one session, and she ended up losing, I think, 40 inches over a period of a couple
You're
of months
kidding
using
me.
the red light. And I can't
Over
really
a couple months? That is insane.
And that was once a week on the red light. She was using that. Now she was doing a metabolic program along with that to get her body healthy. Yes.
Okay.
Yes,
And so
she
are
was.
these changes and these results, are they permanent? How long do they have to come in? I'm sure it's customized to some degree, but can you give us an idea?
The results are permanent. You
Awesome.
know, the red light causes the fat cells to stay open for 72 hours. So, you know, obviously, if you come in and use the red light and then you go out and eat McDonald's, you're gonna have a hard time. You know, so. You know, I encourage people who do want to use the red light therapy, you know, to really commit yourself to change. You know, I mean, if you really want to get the body healthy, do a metabolic program along with that, and do it the right way, because the results are permanent. But like anything else, if you do something and you do really well at it, but then you go back to old habits that are not good.
Yeah. So what's the ideal patient, the mindset of the ideal patient that you want to see in your office?
The mindset. I love seeing people who want to make change in their lives, who want to be better than they were. So, I mean, that's what life's all about, right? You know, we want to improve consistently day to day, and that's the kind of patient I want to see. You know, the red light works, okay? So if you come in and you use it, you're gonna see inches lost. But coming in and using that as a quick fix, just so you can go out and live a lifestyle that's not healthy, I'm not a big fan of that approach.
Right, because those results aren't long-term.
They will be temporary, you know, they will be very temporary. You know, it's one thing, you know, if you want to use it for a couple of sessions to fit into a wedding dress or something, but, you know, it's really, my goal is to get people in here who really want to make change.
Right, so it can be a quick fix, but
it can.
But that's not who you're after, because part of it is your reputation of the longevity of these results too.
That's what I want.
And you want the best for people.
That's it.
Awesome.
That's
That's why I love you. So before we wrap this up, tell me, what is I always ask every doctor I interview, what's your favorite thing about being a doctor?
My favorite thing about being a doctor, I think as doctors, as a chiropractor, medical doctor, whatever kind of doctor you are, I think serving people, you know, helping people, because that's what we're called to do. You know, we want to make people's lives better. And, you know, whether it's through nutrition or wellness or chiropractic care, or, you know, if surgical means, or whatever is necessary, you know, we're here to serve people. So I think that's what it's all about. That's what gives us purpose.
Awesome.
You know?
Aside from the fact that you're one of the best doctors in town in all of DFW, I love your heart. So thanks so much for joining me. And I do want to invite you to call Dr. Matt Thomas if this intrigues you at all. Come in. Do you have a special offer for our viewers?
I actually do. For those that call in, we're going to go ahead and do a special for the first 20 people that call call in mentioning the Wellness Doctor Network, we're going to do a free initial consultation for chiropractic care. And then in regards to the red light therapy, I'm going to go ahead and offer a special on that too. For the first 20 people that call in and mention the Wellness Doctor Network, you can get a $49 session on the red light. And remember what I said about that. That's guaranteed 2 to 5 inches lost in a single session. So the first 20 people that call in on that, $49, which our regular rate, we've been charging $200. So
awesome.
It's a great deal.
Y'all better call fast because I'm about to make my first appointment. So thank you so much for joining us. And thank you for joining us for another episode of the Wellness Doctor Network. I'm Dr. Holland Meyer.